Manalangin tayo. Panginoong Diyos, itinataas namin ang iyong pangalan. Pinapupurihan at pinasasalamatan ka namin sa lahat ng iyong mga ginawa at pagpapala. Salamat sa panibagong araw na ipinagkaloob mo sa amin. At sa oras na ito na kami ay muling natipon. Gabayan ninyo po kami sa aming mga gawain. Bigyan mo po kami ng talino at lakas upang magampanan po namin ang aming mga tungkulin. Buksan mo po ang aming isip at puso sa mga bagong kaalaman na aming matututunan. At nawa ay maging kagamit-gamit ang mga ito sa aming buhay at sa pagtulong sa aming kapwa. Ikaw po nawa ang maluwalhati sa lahat ng aming katagumpayan sa araw na ito. Ito lamang po ang aming dalangin sa pangalan ni Jesus. Amen.
Hi, good evening. I'm Dr. Emerzen Elepanio, the president of the Philippine College of Radiology. Now, I would like also first to thank the Andaman Medical Specialist Corporation for giving us this webinar for this evening. Now, the reason for this request is that around the year before 2010, like 2008, the Mutual ASEAN Agreement ensued. And after this agreement, there were a lot of changes in the Philippine setting, policies in the government that also includes trading, financing, education, healthcare. Even the trainings in the medical schools have also changed, as well as the training in the residency training programs. That also includes the policies in medical device registration. And because of this, there were a lot of confusions from within the Philippines and confusion also from our foreign investors and counterparts, especially with the registration of the medical devices care of the FDA. There were a lot of queries, questions, confusions regarding certain issues, which is to be classified, which medical devices are class A or B or C. So there were a series of information dissemination by the FDA, and they have done so in the different platforms, media and online, and even in television. However, it might not be sufficient for some. That's why we have decided to come up with this webinar. And hopefully, this would be very helpful to our and partners, events partners and our sponsors, especially those who have always been supportive to the PCR, even during the annual convention and its different events. So I hope that after this webinar that Andaman Medical will conduct, we are going to learn a lot about medical device registration and somehow give us an enlightenment on how to start and where to go for questions and queries regarding the process of registration. Now, for this evening, the Andaman medical specialists have prepared for us different lectures, and our lecturers include Miss Melody T. Quebec, RPH, the company's regulatory operations manager, Mr. Romel L. Canton, RPH of the Regulatory Affairs Specialist, Ms. Lori Jean P. Berces, RPH, the Regulatory Affairs Specialist. And we will hear from them, and after their lectures, we will have some question and answer if there will be some queries from our listeners here. So sit back, relax, and happy learning. And I give the virtual stage to Rommel of the Andaman Corporation. Rommel?
Hello? Can you hear me po?
Yes, Melody, we can hear you loud and clear.
Sige po. Good evening, everyone. So welcome po for today's webinar session. So we are from Andaman Medical Philippines Corporation. Our company is a regulatory affairs and market access service providers. So we specialize po in registration of medical devices, authorized representations, importation of medical devices, and we act as a master distributor of all medical devices and different kinds of medical devices and in vitro diagnostic devices in Southeast Asia. So we have branches po in 7 sites. One is from Philippines. We have presence in Malaysia, Singapore, Indonesia, Vietnam, Thailand, and Cambodia. So across all ASEAN countries po siya. So for today's session, we will be focusing on the topic of understanding the medical device regulatory pathway in the Philippines. Joining with me tonight are our very own RA specialists, Romel and Lori, who will be helping me to present the slides later on. So without further ado, I'd like to pass you on to Ms. Lori Berces, our first speaker, to discuss the first and second part of our presentation. So Lori, the floor is yours.
So hello everyone. So my name is Lori and I'll be discussing with you the part 1, which is the general regulatory requirements, and part 2, the medical device definition, which is the risk classification and grouping of our presentation. So these are the contents of our presentation. So it is divided into 4 parts. I will no longer read the details of each part since we will be discussing it one by one. So next slide, please. So who are the regulatory authorities governing medical devices and IVD in the Philippines? So basically, the main agency who regulates medical devices and IVD in the Philippines is the Food and Drug Administration. The FDA is under the Department of Health and it is divided into 4 centers. And the one who is handling medical devices and IVDs is the Center of Device Regulation, Radiation, Health and Research, or the CDRRHR. Apart from FDA, there are other Philippine government agencies that has jurisdictions for some medical devices. However, we will only focus our discussion on understanding the FDA regulations for medical devices. Other regulatory body that governs medical devices are as follows. So the first one is the National Telecommunications Commission, or the NTC, for those medical devices with wireless connectivity features, such as Bluetooth, Wi-Fi, 3G, 4G, and 5G. Second one is the Optical Media Board, or the OMB, for those medical devices with softwares and accessories that comes in USB, CD, or dongle. The third one is the Philippine Nuclear Research Institute for radioactive materials. And then fourth is Dangerous Drug Board, or the DDB. These are for the IVD reagents, control or calibrators with contents included in the Philippines tables of controlled chemicals. And then the Department of Energy and Natural Resources, or the DENR, for the Environmental Management Bureau, EMB, or for IVD reagents, control or calibrators with chemical contents not listed in the Philippine Inventory of Chemicals and Chemical Substances. Next slide, please. Prior to manufacturing, importing, selling, and distributing any medical devices in the market, we need to understand the required licenses and permits to be secured by an establishment to legally operate in the Philippines. So before anything else, the company should have an Food and Drug Administration establishment license and product authorizations. These two types of licenses are different. The FDA establishment license pertains to the LTO of a medical device company. It can be an LTO as manufacturer, trader, distributor, or retailer. If your activity is to manufacture a medical device, then the LTO that you need to apply is for the LTO for manufacturer. If your company is the product owner, or the device has your own brand and you engage with another manufacturing facility to manufacture your own device, then your activity is considered as trader. Next one is for distributor. The activity will be either importer, exporter, wholesaler. If you are directly importing a raw material, active ingredients, or finished product and distribute it to establishment or outlets, then your activity is an importer. If you export products to other countries, then your activity is an exporter. If you are a local company and you procure raw material, active ingredients, or finished product from another local company, and you sell it on wholesale basis, then your activity would be a wholesaler. Last October 2021, the FDA issued FDA Circular 2021-021 entitled Guidelines on the Licensing of Retailers of Medical Devices in the Philippines. This mandates retailers to secure LTO from their office. All existing retailers were given 2 years transition period to comply with this guideline. So after you got your LTO, you need to proceed on securing the product authorization so you can legally market your products in the Philippines. The product's certificate can be either Certificate of Medical Device Registration or the CMDR. This is applicable for Class B, C, and D medical devices not listed in Annex A or the list of registrable medical devices. Next one is Certificate of Medical Device Notification or the CMDN, which is applicable for Class A medical devices and Class B, C, and D devices not listed in Annex A. Next is for the Certificate of Product Registration or the CPR for IVDs. This authorization will soon change to either CIVDN or CIVDR once the new rules and regulation governing the issuance of an authorization for an IVD is issued becomes effective. Last one is the Certificate of Medical Device Listing or the CMDL. This is applicable for medical device that's for personal use, donation, research, exhibit, or not intended for sale. Next slide, please. Okay, since you already know what licenses or authorizations you need to secure, we will now proceed on how you are going to get those authorizations specifically for product authorization. Before we move on the procurement of process of product authorization, we need to understand the definition of medical device in the Philippines. According to AO 2018-002, medical device means any instrument, apparatus, implement, machine, appliance, implant, in vitro reagent or calibrator, software, material, or other similar or related article, which is intended by the manufacturer to be used alone or in combination for human beings for one or more specific purposes. It's either for diagnosis, prevention, monitoring, treatment, or alleviation of disease. Second one is diagnosis, monitoring, treatment, alleviation of or compensation for an injury. Third one is investigation, replacement, or modification. Also to support or sustaining life. Also control of conception, disinfection of medical device, and providing information for medical device, for medical or diagnostic purpose, which does not achieve its primary intended action or on the human body by pharmacological, immunological, or metabolic means, but which may be assisted in its intended function by such means. You need to look at the intended use of your device. If the intended use of your medical device falls under the category mentioned, then you can say that your product is considered as medical device. Next slide, please. Now, how will you know the risk classification of your medical device is? In the Philippines, the classification of medical device follows the AMDD ruling or the ASEAN Medical Device Directive according to risk level. So it's either Class A or low risk, Class B or low to moderate risk, Class C, moderate to high risk, and Class D or high risk. For IVD classification, currently it's either registrable and non-registrable. For registrable IVDs, we follow the FDA Memorandum Circular 2014-005, which is the updated list of medical devices required to be registered prior to sale, distribution, and use. In the Memorandum Circular 2014-005, there are only 8 IVDs required to be registered, but blood collection tube was added on this list pursuant to FDA Circular 2020-01, which is the initial implementation of AO which is the guidelines governing the issuance of authorization of a medical device based on ASEAN harmonized technical requirements. So now the list of IVD will shown to you later. For non-registrable IVDs or those not listed in the Memorandum Circular 2014-005 and its amendment in our current setup, these IVDs can still be allowed to be manufactured, imported, exported, or distributed in the Philippines by just presenting the company's valid FDA LTO. It is also important for you to know the FDA have issued circular references for medical devices classification. So these are the Annex A of FDA Circular 2021-017, which is referring to the reference list of Class A medical device that requires CMD en route. This includes Class A medical devices from the category of anesthesiology, cardiovascular, dental, ENT, gastroenterology, urology, general and plastic surgery, general hospital and personal use, neurology, obstetrical and gynecological, ophthalmic, orthopedic, and physical medicine and radiology device. Other reference is Annex A of FDA Circular 2020-001 and FDA Circular 2020-001-A, which lists different devices from Class A to D that require it's either CMDN or CMDR route. If your product is not listed in either of its reference lists, you must check the intended use of your device and refer to AMDD ruling to identify the appropriate classification or your device. Next slide, please. So just to show you, these are the screenshots of the circular references. So these are the first page of the circular. The circulars I mentioned a while ago is accessible and can be downloadable via FDA website. So next slide, please. This slide shows the screenshots of AMDD Annex 2, so risk classification rules of medical devices other than IVD medical devices. So there are 16 rules with 4 categories. So first one is the non-invasive medical devices covering rule 1 to 4. So these are the medical devices that do not penetrate inside the body. So example of devices under this category are simple wound dressing, adhesive bandages, administration sets, and blood bags, or etc. Second one is the invasive medical devices covering rule 5 to 8. So these are the medical devices which in whole or in part penetrate inside the body, so either through a body orifice or through the surface of the body. So example is are the catheter, cannula, syringe with needle, surgical gloves. The third one is the active medical devices covering rule 9 to 12. So these are the medical devices, the operation which depends on a source of electrical energy or any source of power other than that directly generated by the human body or gravity, and which acts by converting this energy. So examples are MRI, ultrasound, electronic thermometer, dialysis machine. So the last one is the additional rules, which cover the rule 13 to 16. So examples of this are the drug-eluting stents, medical device disinfectants, condoms, IUD. So for full details of the risk classification rules, you may refer to the link shown in this slide on the left, lower left side. So next slide, please. So this slide shows some of okay. When it comes to IVD, as I mentioned, there are only 9 IVDs that requires registration in the Philippines. So these are the HIV, Hepa B, Hepa C, syphilis, um, drug screening test kits, blood typing sera, anti-human globulin reagents, potentiators, column agglutinations, pregnancy test kits, leptospirosis test kits, and blood collection tubes. And other IVDs not included in this list is currently considered as non-registrable. Next slide, please. So this slide shows some of the practical tips that we are doing in checking the classification of a medical device if the device is not listed on the FDA circular references. So first one, we check the instruction for use with intended use of the device and look for the appropriate ruling in the AMDD. Second one, we also refer to the declaration of conformity. The declaration of conformity usually contains the classification of the device. In the other countries, these are the classifications. If it's class 1, it's equivalent to class A for ASEAN. Class 2A, equivalent to class B. Class 2B, equivalent to class C, and class 3 is equivalent to class D. The third one, you can also check with the ASEAN member countries classification, so through their public search inquiry. From our case, we are using SMDR Public Inquiry of Singapore, MDA Registered Medical Device Search of Malaysia, and also our very own FDA verification portal. So lastly, to distinguish if the product is a general medical device or IVD, you can also look the product label for the symbol MD stands for medical device and IVD stands for in vitro diagnostic. Next slide. Okay, so when you have already determined the classification of the medical device, you can now prepare your product dossier. However, maybe some would have a question if they can group their product application as one submission or not. So currently, there are no groupings available in the Philippines. All applications shall be made separately for a specific medical device. In case of the following conditions, only one application can be filed. However, separate CPR shall be issued. So first one is a medical device with accessories, wherein the accessories are intended to be sold separately. Second one is a medical device owned by the same legal manufacturer that is manufactured in different manufacturing plants and will be both distributed in the same time in the Philippine market. A medical device system where the use of one part of the system is intended to be used together with all or any part of the system. Also, a medical devices with the same intended use and the same manufacturing process, but differ in one or more raw materials. Also, medical devices with the same intended use and the same manufacturing process, but differ in the design. Lastly, medical devices with the same raw materials, but differ in types or shapes, resulting in the different specific intended use. So if your product falls under this criteria, you can apply for one application multiple CPR scheme. With this scheme, you can submit one application for multiple devices following the above category, but you must pay separate registration fees for each device. So this is the end of my presentation. I will now forward you to Miss Melody, who will discuss the registration requirements for the medical devices. Over to you, Miss Melody.
Okay, thanks, Lori. Okay, so we now go to the part 3 of our presentation. This one is somehow quite boring, but it's more technical part of the discussion, which focuses on the requirements of medical device registration. So the slide shows the common legal requirements for the notification of Class A medical devices and registration of Class B, C, and D medical devices. So these are the legal requirements. So notarized application form for the distributor, local manufacturer, and trader. For CMDN applications, so the application form is formatted via the e-portal. So you no longer need to upload a separate notarized application form. However, for the CMDR, it is required to have a notarized copy of the application form. So the form shall contain different details like the product name as well as the manufacturer's information. It should be consistent across all the application documents. The form should be properly and completely filled out. It shall contain brand name, medical device name, and the device risk classification, and also the LTO number of your company. For medical devices having multiple codes, so you may include an annex to your application form that lists all the codes of your product. Next is the notarized agreement or letter of authorization from the product source. So this is the agreement between your company and your direct foreign supplier. So the agreement or the LOA should be, of course, valid. It contains the list of the products that you intend to apply in FDA. For imported medical devices, it should be accompanied with notarized declaration from the legal manufacturer or product owner attesting that the authorization or agreement is true and correct. If the imported medical device, its agreement are signed in the Philippines, it must be notarized locally. So it must include the passport ID page and record of arrival and departure of the principal to and from the Philippines of the one who signs the LOA or the agreement. For open-dated agreements or authorizations, those agreements that without validity. So if the certificate is beyond 5-year period, you need to get from the manufacturer a reissued copy of the agreement or authorization and must be submitted or a notarized attestation by the principal that the agreement or authorization is still in effect. Red ribbon or apostille copy of the LOA or the notarized agreement will still be acceptable by FDA, provided that the issued date shall be on or before September 2020. Next slide, please. Sorry. Quality Systems Certificate of Approval. Next requirement for the legal is Quality Systems Certificate of Approval or the ISO certificate, ISO 13485. This is particularly for medical devices. In the absence of ISO 13485, FDA also considers GMP or Good Manufacturing Practice Certificate and ISO 9001. So this QMS certificate, it should be valid and also accompanied by a notarized declaration from the legal manufacturer or product owner attesting that the certificate is true and correct. For products that are manufactured in multiple sites or toll manufacturers, you need to identify or highlight the product source for easy reference of the evaluator. It shall include the product being applied, and it must be included or indicated in the scope of your ISO certificates. For locally manufactured products, you need to provide the valid LTO of the manufacturer. Product approval certificates is the next requirement. So these are in the form of certificate of product notification or the certificate of product registration or any other equivalent document attesting to the safety and effectiveness of the device. So this requirement should be valid also, and it should be issued by the regulatory agency or the health authority of the country or accredited notified body in the country of origin. So there are many notified bodies who issues ISO 13485. Some of it are TUV, BSI. So these are some of the recognized accredited notified body. The product approval certificate shall be accompanied by an authorized declaration from the manufacturer, from the legal manufacturer or the product owner, attesting that the certificate is true and correct. So some of the examples of the product approval certificates are the US FDA 510K. For Canada, it's called Health Canada license. For Australia, it's TGA approval. For Singapore, it's HSA online registry system. So the one in Medix. And then for Malaysia, it's MDA certificate. And for European countries, it's CE certificate. Next is the clear colored picture of the actual commercial product sample device. So it should include the pictures of the device in all sides without its packaging. Pictures should not be pixelated when the view is increased in size or it is zoomed in. For products with multiple codes, a representative photo can be provided, but we suggest to include a declaration letter from the manufacturer explaining the rationale of providing only one representative photo for all the products being applied. So basically, these are the common legal requirements for Class A, B, C, and D medical devices. Next slide, please. We now go to the technical requirements of CMBN for Class A medical devices and Class B, C, and D medical devices not listed in Annex A. So the reason why I mentioned Class B, C, and D medical devices not listed in Annex A, currently we are still on the transition period, and those Class B, C, and D medical devices not listed in Annex A shall undergo the CMDO route. So the requirements are lesser than the CMDR, and these are the following. Device description. So the device description, you can usually found it in your IFU or the instruction manual of your device. So it includes the intended use, instructions for use, list of raw materials, technical specifications of the finished product, and the list of reference codes, sizes, colors, models, and variants, whichever is applicable. Certificate of conformity on the aspect of manufacture relating to metrology or devices with measuring functions. So there are medical devices that has measuring functions. So this is quite different from the third requirement, which is the declaration of conformity. So certificate of conformity, basically it's a certificate that is issued by the metrology department of a specific country. So when we made previously, when I have an application for this medical devices, so I made an inquiry because I don't know actually previously what kind of document would I need to provide to FDA to comply with this requirement. So as per email inquiry from FDA before, so they said that they can accept EC certificate that mentions in its scope the conformity of the product with the metrological requirements. So if you have a product that has a measuring function and you have the EC certificate for that product, you look for the scope of the EC certificate that mentions that it conforms with the metrological requirements of the country of origin. Another one, if they don't have, for example, your legal man or the manufacturer couldn't provide you this certificate of conformity or this EC certificate with the scope of conformity to metrological requirements, you can have your product tested here in the Philippines via the National Metrology Laboratory. And they will issue you a calibration certificate. So as per FDA, they also accept calibration certificate issued by National Metrology Laboratory. So this one is the two documents that can comply the requirement of certificate of conformity. Next is declaration of conformity. This is a self-declaration by the manufacturer. This document should include the list of product standards used. There is no specific format actually or template for this. And as per our experience, the FDA accepts VOC format of EU or the European countries, and also the AMBD. So in AMBD document, there is actually a template of the declaration of conformity. So if your manufacturer doesn't know how to do the declaration of conformity, then you can provide also the template coming from the AMPD. The most important point here is to make sure that the product standard used in the device are listed, because that's the one being checked by the FDA evaluator. If you only provide the declaration of conformity without the list of product standards, then you are sure that it would be a compliance on your part when FDA provides you the NOD. Next is the clear and colored pictures of label from all sides of the packaging. So the labels could either be loose label, artworks of all the layers of the packaging. So it would be the immediate label, secondary label, and the shipping carton label. So it shall contain the name of the device in the label, and the name of the device shall match the device name indicated on your notarized application form. The LPO, batch number, serial number, whichever is applicable. The expiration date, reference codes, sizes, variants, model, whichever is applicable. Storage condition, so it shall match with the one indicated in the IFU of your product. So if in your IFU it mentions there that the product shall be stored in 2 to 8 degrees Celsius, then your label should have the same declaration. Sterilization method. So in labels, this is usually presented as symbol. So example, you will see a symbol of EO. So that means the device was sterilized using ethylene oxide sterilization process. The symbol of R means it was sterilized using irradiation method. H2O2 sterilization via vaporized hydrogen peroxide. So when you have this symbol on your label, you have to include the sterilization procedure, validation, and verification report in your submission. Next is the name and address of the importer and distributor together with the product registration number. So it's mandatory in Philippines to reflect the name and address of the manufacturer, of the importer and the distributor, alongside with the product approval number, the CMDN or the CMDR number. So the pictures of the label shall be clear and will not be pixelated when the view is increased in size. Also, if your label has a CE marking, you need to submit a valid certificate supporting the placement of the CE mark. For imported medical device, if the local company makes its own brand, a declaration from the manufacturer allowing the use of the brand name and IPO approval of the said brand shall also be submitted. If the label is the same among the different product codes variants, you need to submit a certification or a declaration from the manufacturer explaining that you are only submitting one representative label for all the product codes. For local manufacturers, IPO approval of the brand name shall also be submitted. And lastly, declaration of shelf life. So if your product has a claimed shelf life, then you need to request from the manufacturer a declaration letter stating that stating the shelf life of your product. If shelf life is not applicable for your product, you still need to submit a declaration letter stating the reason why shelf life for the product is not applicable. Next slide, please. So this slide shows the technical requirements for CMDR applications, which is applicable for Class B, C, and D medical devices that are listed in Annex A. So the technical documents shall follow the ASEAN Common Submission Dossier Template, or the CSDT. So it is composed of 7 sections as follows. Executive summary. So the executive summary is an overview or introductory descriptive information of the medical device. For some evaluators, they would ask also for synopsis of the content of the CSDT, or the brief summary of the CSDT documentation. So to avoid further or future NODs, you initiate the creation of the CSDT synopsis and include that in your dossier submission. The executive summary shall include the following. So it includes the intended use and indications for use of the device, any novel features, commercial marketing history, list of regulatory approvals or marketing clearance obtained. For example, if you have listed 5 regulatory approvals for your products in your executive summary, you should attach as well the copy of the 5 product approval certificates, because sometimes the evaluators are looking for the one that you declared on your list of regulatory approvals. They will look for the appropriate approval certificates as well in your dossier. Status of any pending clearance for market clearance. Status of any pending request, for market clearance. So this refers to the list of your pending product registration applications from other countries. So if in other countries, you still have a pending application and it's not yet approved in other countries, then you have to declare it as well on your executive summary. Important safety performance related information. So this one pertains to the FSCA, or Field Safety Corrective Action reporting and the product recall. So if your product doesn't have FSCA or product recall reporting yet, then you have to request from the manufacturer the declaration letter related to this. Next is the Essential Principles Conformity Checklist. So usually this is presented in a table form by the manufacturer. So it indicates the general methods used to demonstrate conformity of each applicable essential principles. So this includes the different recognized standards used for medical devices. One thing that I could share with you on this, please check if your essential principle conformity checklist includes the ISO 13485 standard, because we have some experiences as well that this is being asked by the evaluator and it's being checked and it becomes one of the NODs. So when you receive your essential principle checklist, essential principles conformity checklist, if the ISO 13485 is not included there, then you have to ask your manufacturer to include that to avoid NODs with FDA. Next is device description. So besides the general description of the medical device, a more detailed description of the medical device attributes is necessary to explain how the medical device functions. So it shall include the intended use of the device, the indications for use, instructions for use, contraindications, warning, potential adverse effects, alternative therapy, and raw materials or formulation. So for raw materials, it includes list of raw materials used as component of the product. This includes both direct and indirect materials that are direct or indirect contact to the patient, and this shall be coupled with raw materials, MSDS, or the material safety data sheet. If the device contains PVC or polyvinyl chloride, so you need to identify the PVC plasticizer used. Next slide, please. Other relevant finished product specifications, this can be in the form of certificate of analysis or test certificates with finished product specifications, including the chemical, physical, mechanical, biological, software, stability, storage, transport, and packaging, whichever is applicable. The stability, functionality, and packaging integrity tests for the product shall also be included, which is duly signed by the person who conducts the studies. For accelerated stability study, you need to submit a computation to justify the storage conditions used. If you do not have any expiration date on your label, the same way with the requirement from CMBN, you have to provide a declaration letter or a justification from the manufacturer why the device has no expiration date. In-use stability study, you need to submit it if, for example, your product is a contact lens solutions, or disinfectant. Packaging declaration to clarify the type of packaging used, whether it's in the form of blister pack, plastic pack, carton pack. And lastly, for medical devices with animal tissue origin, you need to submit a certificate issued by the government authority showing that the animal tissue is free of disease. And to submit documents showing compliance with ISO 22442 or the medical devices utilizing animal tissues and their derivatives. Next slide, please. The next requirement is the summary of design, verification, and validation documents. So this section should contain design verification and design validation data to the extent appropriate to the complexity and risk classification of the medical devices. It should include the declaration of conformity. Again, this one should have the list of product standard use, summary of reports of tests and evaluations based on the standards, manufacturer methods and tests, or alternative ways for demonstrating compliance, such as listing of and conclusions drawn from published reports that concern the safety and performance of aspects of the medical device with reference to the essential principles. Data summaries of test reports and evaluations covering appropriate test reports, whichever is applicable. So it's either engineering tests. Example of these engineering tests are the electrical safety test reports and EMC, or the electromagnetic compatibility test reports, conforming with the IEC 60601. Laboratory tests, biocompatibility tests. So these are for medical devices, especially for invasive medical devices. So you needed to have this biocompatibility test as part of your submission dossier, or the biological evaluation that conforms with ISO 10993. So examples of the biocompatibility or biological evaluation tests are cytotoxicity, sensitization, irritation test, toxicity test, and the others. Animal tests, simulated tests. So simulated test is somehow similar to the engineering test. Software validation, if your medical device do have a software, so you have to include also the software validation. Preclinical studies, clinical evaluation report conforming to the ISO 14155. Next requirement is the labels, or the clear and complete colored pictures of the labels from all sides of the packaging. So actually, this one is similar to the one that I have discussed earlier. So I will no longer mention again what are the details for the labels. Next slide, please. Risk analysis and result. So this one can be in the form of FEMEA or failure mode effective analysis, or risk benefit analysis evaluation, or risk management report, and outcomes of the effectiveness of control measures. The ISO standard for this risk management or risk analysis is the ISO 14971. Lastly, the last requirement is the physical manufacturer information. So it should include the complete manufacturing process from receipt of raw materials to finished product, including its quality assurance procedure. So it can be presented in a flow chart, but you have to make sure that the flow chart, the details of the flow chart are somehow complete. Otherwise, FDA would ask you to provide a narrative description of the flow chart, which includes the quality assurance measures observed during manufacturing. So brief summary of the sterilization method, the standard parameters, sterilization procedures, validation protocol, and results of the latest sterilization revalidation. So again, if your product do have the symbols that the product is sterilized, so it's mandatory for you to provide sterilization test procedures and validation reports. So if the sterilization, the device is sterilized by a third-party sterilizer, so a valid ISO certificate of the contracting sterilizing company shall also be provided. For non-sterile medical devices, you need to provide a declaration letter that the medical device is non-sterile. Sterilization guidelines prior to use. So if, for example, your medical device, before using it requires sterilization, so the procedure for the sterilization shall also be included in the submission. So we finished the discussion on the requirements, the CSDT requirements for CMDR applications of Class B, C, and D medical devices. So just a few reminders on how you will prepare your dossier to be submitted to FDA. So your documentary requirements must be arranged and labeled according to the CSDT format and checklist of requirements as per AO 2018-002. So FDA is very particular on the arrangement of your requirements. So you cannot put the medical device description on the first part before relevant essential principle checklist. So you have to follow exactly what is the chronology of the requirements. Otherwise, FDA will disapprove your applications during the pre-assessment. All documents must be submitted in English language. So documents submitted in any other foreign language not accompanied by English translation will automatically be disapproved by FDA. It should be, the document should be in portrait presentation. It shall be in PDF searchable format and at least 150 DPI. Two ways of submitting the documents to FDA. On our part, it's either we merge the file as one continuous file with table of contents, page separator, and page numbering. But FDA is also accepting documents that can be consolidated using folders that has proper numbering and name based on the document it contains. Next slide, please. Okay, this slide shows the documentary requirements for registration of IVD medical devices. So a while ago, the one that I have discussed is more of the general medical devices. So this slide is focused on IVD medical devices. So the requirements for legal and technical requirements for IVDs, these are the notarized application forms of the distributor, local manufacturer, or trader The details of it is similar with the one that I have explained earlier. The valid license to operate of the distributor, local manufacturer, or trader. So this is somehow different, no, from uh, the list of requirements for general medical devices, because it no longer requires for us or the company to provide the LTO in our submission dossier. But for IVDs, it's still mandatory to include the copy of your valid LTO. Valid certificate of clearance. By the way, sorry, for the valid LTO, of course, it should be for local companies, it should be valid. No longer requires notarization. But if, for example, the LTO equivalent in other countries, no, for example, the product is imported and it's manufactured in other countries, that LTO or its equivalent like QMS documents like ISO 13485, the CE certificate, this document requires legalization or authentication from the Philippine consulate of the product's country of origin. Number 3 is the certificate of free sale or registration approval of the product from the country of origin issued by the health authority. This one is another major difference, no, from the requirements of general medical devices, because general medical devices doesn't require CFS or certificate of free sale. It's because FDA mentioned that free sale certificate is actually not an equivalent to product approval certificates. But for this case, because the new medical device, the new IVD regulations is still on draft and it's not yet issued by FDA, we are still following the current requirement. So they still require the CFS, or if they don't have the CFS, the product approval certificates like the one I mentioned a while ago, the TGA approval, the US FDA, the Health Canada license, HSA online registry. So these are the documents that you can submit for requirement number 3. So this requires legalization or authentication from the Philippine consulate of the product's country of origin. Valid ISO 13485 or GMP certificate of the manufacturer for imported product. This one is what I have discussed earlier. That for foreign medical devices, no, or for imported medical devices, so the ISO or the QMS document of the legal manufacturer and the physical manufacturer shall also be submitted. So either ISO 13485 or GMP certificate. Copy of the latest certificate of product registration or CPR. This is only applicable for renewals if you are doing renewals for IVDs. LOA or certificate of foreign agency agreement between the manufacturer and trader, distributor, or importer. So LOA or your agreement with your foreign supplier or agreement with another manufacturer here in the Philippines. This is also one of the requirements for IVDs. Specific use and directions for use, instructions for use, or the product brochure. List of raw materials used as component of the reagents or test kits. Again, this one shall be coupled with material safety data of all the raw materials. Technical specifications and physical description of the finished product. So this can be in the form, as what I've mentioned, this can be in the form of certificate of analysis, the list that lists down all the specifications of your medical devices and the results. So FDA usually accepts certificate of analysis that has test results which are quantitative and qualitative. But sometimes if FDA only sees in your report that the result is pass or fail, they do not accept it. They wanted somehow a quantitative. If the specification is in quantity, then the result should be in quantitative value also. Brief description of the methods used, the facilities and control in the manufacture, processing and packaging of the IVDs, and the process flow chart showing an overview of the production. So similar to general medical devices, the process flow, manufacturing procedure shall also be included, including its process control. Risk analysis with control measures, so either FEMEA or risk management report, these are acceptable to FDA. Stability study performed at 3 different product lots manufactured under real-time conditions. So for actually for initial registrations, no, they can accept accelerated stability study. But during renewal, you have to submit already the real-time stability study of the device. Labeling materials, so shall include the immediate label, secondary packaging, the box, and the package insert. So the details of this is similar to what I have discussed with the general medical devices. So for IVDs like pregnancy test kits, 15 samples of the same lot with at least 9 months expiration date shall be provided because IVD test kits for pregnancy test kits per se is being evaluated by the FDA laboratory. But for other IVDs, the performance evaluation test is being done by different national reference laboratories in the Philippines. So the number of samples will depend on the different NRLs. Okay, so for the initial, if you will see here on the table, all of this number 1 to 14 are the requirements for initial. For renewal, the one that you don't need to provide is number 7, which is the specific use and directions for use, the list of raw materials, the certificate of analysis or the technical specifications, brief description of brief description of the methods or the manufacturing procedure, and the risk analysis is no longer required for renewal. The rest of the requirements are still required to be submitted. Next slide, please. Okay, so this is the last part of my presentation, which focuses on the requirements for medical device renewal registration. So if you will see here, it only includes all the legal requirements, which is number 1, 2, 3, and 4, and the product labels, which is number 5. So if your product is do have already a CPR, so either it's class B, C, or D medical devices, or the one that is listed on Annex A. So when you apply for your renewal registration, these are the only requirements that you needed to fulfill. But if your products receive, let's say, class B, C, and D medical devices, and you were issued with a CMDN certificate because of the transition period that we are having right now. So you cannot use this, you cannot renew your products actually. You cannot undergo the renewal once the CMDN certificate expires. Based on the regulations of FDA in the transition period, 3 months before the expiration date of your CMDN certificate, specifically for class B, C, and D medical devices not listed in Annex A, you have to undergo initial registration via CMDR route. So the list of requirements that you needed to prepare are the CSDP requirements. Okay, so I will now forward you to Romel for the discussion of part 4, which includes the submission method, process, fees, timeline, validity, and registration update. So Romel, the floor is yours.
Thank you very much, Ms. Melody. After knowing both the legal and technical requirements for CMDR, CMDN, and IVDR, we now go to the different ways on how the products are being applied or submitted. For CMDN, as you can see on this slide, it's being submitted through the FDA ePortal account. There is no limit on the number of submissions. If you have 100 applications, you can submit them in 1 day. Before you can access this e-portal, you must first create a user account. The application for which is not as straightforward as what you may be used to. Instead of a simple sign-up button, it involves sending a few emails. You can refer to FDA Circular 2016-004, named Procedures on the Use of the New Application Form for License to Operate through the FDA Electronic Portal. Please take note that pair at fda.gov.ph mentioned on this circular is no longer being used and was changed to fdac at fda.gov.ph. For CMDR, CPR, or IVDR applications, it shall be submitted to CDRR-HR-product registration at fda.gov.ph with a maximum of 5 products per company per week. There are also schedules of submission being followed. Company A starting from A to M or Alpha to Mama are only allowed to submit their applications on Thursdays, and N to Z or Nancy to Zeta on every Friday. If you receive a notice of deficiency or NOD, then you have to comply this before the deadline set by the FDA evaluator. Compliances can be submitted in any day of the week, and you will send it to fdac.pacd@fda.gov.ph. You can refer to FDA Circular Number 2020-26 or the FDAC New Normal Operational Guidelines of the FDA for the email subject format being followed when sending a compliance. Now, if you have other applications such as Certificate of Medical Device Listing, CMDL, Special Certification for COVID-19 Test Kits, yes, because right now COVID-19 test kits are not considered to be registrable IVD, but it requires special certification which can be applied any day of the week. Renewal application has a maximum of 5 products per week, and variation, amendments, or any changes needed has a maximum of 2 product application per company per week. Considering you have submitted all your applications, we are going to show you the current registration process flow for CMDN. First part is you submit the application via the e-portal. It will undergo pre-assessment. So if the products are complete and assessed as acceptable or passed, you will receive an order of payment. However, if the document is assessed and has deficiencies, the application is considered as failed, and then you will receive a rejection letter letting you know that you must reapply again. Remember to comply all deficiencies listed in the by the evaluator before reapplying to make sure the application will pass. The most important thing to remember for the application is to attach the previous rejection letter to serve as a reference for the next evaluator. For CMDN, when you receive an order of payment, somehow it means 80% approved. Once you pay the government fees, it will undergo evaluation and checking before approval. CMDN certificate is being downloaded from the e-portal upon approval. You will receive a notification on this through your designated company email at company email address. And you can check the application case number on the FDA document tracking website, which is https://www.fda.gov.ph/kiosk Kilo India Oscar Sierra Kilo /. For CMDN, processing time is around 3 months. For CMDR process flow, you will need to submit the application to CDRR-HR-product registration at fda.gov.ph to undergo pre-assessment stage. Same with CMDN. If you pass, you will receive an acknowledgement receipt and order of payment with an assigned document tracking number. When you fail, you will need to comply with the list of deficiencies and do the resubmission. Same important thing to do is to include the previous rejection letter to serve as reference to the next evaluator. So once you have paid the government fees, it will undergo the first evaluation. In FDA CDRR-HR, there is a very slight chances that you can get an outright approval. Usually they will provide either minor or major deficiencies. If luckily you pass the first evaluation without any NOD, then you will receive a CMDR. But if there are deficiencies, FDA will issue an NOD and must submit compliances via the fdoc.pacd@fda.gov.ph. If the evaluator is not satisfied with the compliance submitted and needs more clarifications or documents, then a second evaluation will take place. If you pass the second evaluation, then you will receive the approved CMDR. But if you failed again, you will receive a disapproval letter. But the good thing here is that you can reapply within 60 days upon receipt of this disapproval letter. And the nature of the submission will only be to comply the remaining NODs given by the same assigned evaluator. And reapplication has a corresponding fee of 1,010 pesos. The reapplication will undergo and will be called the third evaluation. But if unfortunately you still fail the reapplication compliance, the CMDR's application's disapproval will be final. And it will be tagged as turned initial application, which means you will need to start all over and pay the application fees same as an initial application with a new document tracking number assigned. So when this happens, this is a tip that I can share with you. When resubmitting the turned initial application, you can include the last NOD you have received for the same product being applied. By doing so, the next evaluator who will handle the new application will have an idea why it was disapproved the first time it was applied. It might help expedite the evaluation but does not guarantee outright approval, as the process flow is discussed, as I discussed it, is very strictly followed by CDRR-HR. The timeline for CMDR application process takes 12 months. So after knowing the process flow, we need to know what is the validity of each issued certificates, government fees to be paid, and timelines of approval. In the CMDR route, validity is 5 years with a fee of 7,575 pesos per application, with a 9 to 12 months timeline of application processing based on experience. For CMDN Class A, the validity is 5 years, fees of 7,575 pesos per application with 1 to 3 months timeline of application processing. For CMDN Class B, C, and D, the validity is 2 years. Fees is 3,030 per application with 1 to 3 months timeline of application processing. These are other informations that you might be interested to know. So you can see on the second table below. For any changes regarding the approved product, you can check the FDA website. Just go to downloadables, down to the CDRR-HR, medical device registration requirements, and you can see there a file titled Checklist Requirements Variations CPR. Then you can just click on that document. It's a PDF file, I think, and then you can see all of these changes that will be applicable to you. You can apply also a change notification for CMDR or CMDN amendment. This is allowed by the FDA with a fee of 510 pesos per change, and the timeline is 1 to 3 months. License transfer is also allowed, or change of ownership, with a fee of 510 per change in CPR, CMDR, CMDN, and the timeline is 1 to 3 months. License termination is also allowed. This means that you no longer plan to distribute the product. There is no fee being paid, but Philippine FDA will require the original license to be surrendered to their office. This can be done by sending through a courier or scheduled delivery to FDAC satellite office. After they receive the letter of termination, FDA will issue a DTN and letter of acknowledgement. Notifying FDA of the license termination will serve as a supporting document in explaining to FDA field inspectors that these products are no longer being distributed. As per our experience, an inspector will require you to renew the certificate and pay the surcharge fee incurred for the long time past since it was expired. And this happens if you have not declared termination of license during the time of inspection. Lastly, multiple registrants for the same product is allowed. Yes, because in the Philippines, if you are not the only or not the exclusive distributor, any other distributor can also register the same medical devices as long as the agreement between the supplier is non-exclusive. Please refer to the list of fees and timelines discussed above. We have to emphasize the new regulations in the Philippines and the initial implementation stage and its transition period. The initial implementation for AO 2018-002, it happened on March 2020. It was during the start of pandemic that the FDA Circular 2020-001 became effective. This circular states that it is mandatory to apply for CMDR for medical devices with risk classification of B, C, and D, and that this is included in the FDA Memorandum Circular 2014-005 and 2014-005A, or we call it the Annex A. Application of CMDN is also mandated for all medical devices with risk classification of Class A, whether or not the medical device is included in Annex A. And you can also have products that will undergo CMDL for research, clinical trial, exhibit, personal use, and donations and brand new medical devices. Next is that this circular was amended to FDA Circular 2020-001-A, which clarified the classification and updated the list of medical devices that are required to be registered with FDA as part of the initial implementation of AO number 2018-002. It comes to a point that we undergo the full implementation, and it took effect on March 2021, a year after the initial implementation. It was issued under FDA Circular 2021-002. In this circular, it mentions that all Class B, C, and D medical devices not included in the Annex A shall apply for a notification or a CMDN. CMDN validity is 2 years only, and 3 months before the expiry date of the CMDN certificate, the company shall apply for the CMDR for the medical device Class B, C, and D. Transition period. This one is the main important thing that we needed to understand. The issuance of FDA Circular 2021-002B aims to extend the date wherein all the non-registrable Class B, C, and D medical devices not included on the list of registrable medical devices, which is the Annex A, may continue to be manufactured, imported, exported, distributed, transferred, sold, or offered for sale without a CMDN. During this time, you will only need a valid license to operate as importer of medical devices to be able to import the actual product in the Philippines. On the next slide, you will see the periods of these transitions. So until March 31, 2023, next year, all Class B, C, and D and medical devices not listed in Annex A that are already in the Philippines may continue to be manufactured, imported, exported, distributed, transferred, offered for sale without a CMDN. But starting on April 1, 2023, only Class B, C, and D medical devices with issued CMDN or with pending application for CMDN shall be allowed to be manufactured, imported, exported, distributed, transferred, offered for sale in the Philippines. A pending application is defined as those application with an issued order of payment or passed the FDA pre-assessment. If you applied for CMDN but have not yet received any order of payment, it is not considered a pending application. Bureau of Customs will not consider the acknowledgement auto-reply email sent by ePortal that is being sent when you submitted an application. So again, March 31, 2023 is the last day of acceptance of CMDN applications for Class B, C, and D medical devices. And on April 1, 2023, FDA accepts the CMDR or Certificate of Medical Device Registration application for Class B, C, and D not listed on Annex A. So that's it. What are the new updates and drafts circulars being made by FDA so far? So these are the two new regulation issued by FDA. The first one is a very helpful issuance. The first one is the abridged approval for FDA or the FDA circular number 2022-002. Date of issuance is September 27, 2022, which aims to provide guidelines on the abridged processing of applications for registration of medical devices with product approval issued by the National Regulation Authority of any ASEAN country under the AMDD CSDT requirement. In this abridged approval, the clients must still need to submit all the technical documentation. The review of the technical documentation would be limited to the completeness at the point the client was in abridged approval. FDA will just be focused more on the legal requirements and the labels. So the good thing here is that the timeline set by FDA for processing is only 30 working days. That is very fast. But we will see if they will commit to it. Check with your manufacturer if there are any approved registration from any ASEAN countries. Current ASEAN countries following the CSDT format is Singapore, Malaysia, and Thailand. And you can just check on them on your manufacturer. The second one is the license to operate as retailer, which is already mandatory based on the FDA Circular 2022-007. Use of e-services for retailer and date of issuance is September 9, 2022. The objective of this circular is to provide the guidelines on the use of FDA e-services portal system for the LTO application of retailers of medical devices. So this is a new issuance which mandates the application of as a retailer already discussed in the first part by Lori. They have 2 years to apply this LTO before FDA mandated penalty without license to operate. So a 2 years transition period is given. We now go to the upcoming draft circular, which will be approved very soon. First draft is the draft on good storage and distribution practices for medical device. Currently proposed policy has been finalized and documents are being prepared for clearance. GSD PMD actually outlines the guidelines during the actual inspection by FDA field officer. This contains the details checklist being followed by the inspector on what documents you need to present during the audit. For other countries, they have this GDPMD certification. This is similar to this one, but in our case, FDA is auditing us GSDPMD, but they do not issue another certificate. Apart from having an establishment license or valid license to operate, they can engage with distribution activity. If you pass the inspection, they will evaluate your company as compliant and wouldn't have any issues during the renewal of the LTO. In other countries, it is mandatory for them to have a GDPMD certificate apart from having an establishment license or valid license to operate before they can engage in distribution activities. Second one is the draft on the adoption of the post-market alert system requirements. Annex 5 of the ASEAN Medical Device Directive, AMDD, is now re-endorsed to the UH for review and approval. This one is related to different aspects of post-market surveillance, from mandatory reporting, product safety or quality issues, product complaints, handling, and product recall. This guideline will cover all those aspects, but you can refer to Annex 5 of the ASEAN Medical Device Directive for more details, because Philippines is currently following this and will just officially issue a circular on adopting it. Third and last, draft on the rules and regulations governing the issuance of an authorization for an in vitro diagnostic medical device, or IVD. Undergoing the final draft for in vitro diagnostic administrative order is already been forwarded for final review and approval of the Secretary of Health. So once it is signed, the regulation for IVD will be laid down and will undergo mandatory registration for CIVDN, or Certificate of IVD Notification, and CIVDR, Certificate of IVD Registration. And as per the director herself of CDRRHR, it will be implemented anytime soon. So this is the end of our presentation. We are open to receive questions from our dear attendees. I will be giving the floor to Doc Emerson. Thank you very much.
Hi, thank you, Romel. Thank you, Ma'am Lori, and thank you, Ma'am Melody. So your lectures are so overwhelming. It is now that our viewers realize how difficult it is to have your products register. They have to comply with a lot of steps. They have to come up with a lot of documents. And not just that, they have to arrange them properly so that FDA will look into them seriously. So after these lectures, because most of our viewers here are doctors, probably they have already realized how complicated it is to have a medical device registered under the FDA. Now, because of these procedures also, no wonder that a lot of our companies are having difficult time having their products registered. Now, I have a few questions, like one, when a medical device is offered here in the Philippines, is it true that it is required that that medical device has to have a local distributor before it can be sold commercially here in the Philippines? Of course, it has to be FDA approved. Pero required ba for a company to have his medical device approved, he should have a local distributor counterpart here in the Philippines if the origin of the device is abroad. So anybody can answer, Rommel, Melody, and Laurie.
Yes, Dr. Emerson, if the product is an imported medical device, so it's mandatory that they have a local representative in the Philippines, because the one who will be applying the registrations in FDA is a local company. The foreign manufacturer or the foreign supplier cannot apply an LTO in the Philippines. It must be a local company. So yes, the answer is yes. It must have a local counterpart in the Philippines.
Yes, especially now that our online transactions are so easy. Kami as doctors, we get to receive a lot of proposals from foreign distributors or foreign companies offering their products, and then requesting that they be available commercially, etc., etc. So we have to explain to them that, of course, these products first have to be FDA approved, and for them to have their products FDA approved, they need to have a local distributor as well. Now, we have to remind everybody, our viewers, the doctors and non-doctors, that as much as possible, all of our medical devices has to be FDA approved, because there is a corresponding penalty for those using non-FDA approved devices, as well as penalty for those distributing and using them commercially if they are not yet FDA approved. So in radiology kasi, in our practice, we get to use a lot of medical devices, and sometimes we do not scrutinize them anymore if they are FDA approved or not. So I think it is high time that we as radiologists also should be more proactive and see if the devices we are using are FDA approved, whether it be hardwares like the machines that we use, or even softwares like AIs that are here everywhere. So as Engineer Matienzo has relayed in the previous certification session, they have done previously on medical device registration certification. She said that the AIs used or the softwares used as medical devices need also to undergo FDA approval, whether it be classification or registration, depending on their use. However, this is not yet really crystal clear. That's why probably in the future we need to talk to FDA and have them clarify regarding this, because we have a lot, of course, of companies inquiring us about this. Okay, are there other questions? Yes.
Just to add on lang po no, sa message na regarding sa AI or dun sa softwares. Kasi recently, for radiology devices, there are already companies who are really seeking for CMDN or notifications. One example is PACS. So I know PACS is being used in radiology. So a lot of companies are already getting CMDN certificates for PACS. So if your company is engaging with software, so you just have to determine if it's a class A, B, or C medical devices. Then you have to know what route of registration you are going to do. But for since software is included in the medical device definition, then definitely you need to notify or register.
Yes, that's true. Like especially now, teleradiology has been a hot issue, especially with the DAP of the DOH, because they are trying to promote the telemedicine platform. So it's also important for these devices to be FDA approved, because as per HTAC or even PhilHealth, we need all of these devices to be FDA approved for reimbursement purposes if ever they become included in the packages of PhilHealth. I think we have someone raising his hand. I couldn't see the name. Is someone raising his hand? Erwin? I think Dr. Erwin has a question. Okay, I think he has no microphone, but this is his question. Can a radiology department request that AI FDA approval be evaluated as independent of the hardware? Okay, I'll repeat the question. Can a radiology department request that AI FDA approval be evaluated as independent of the hardware? So I think what he's asking is because there are certain, like for example, CT scan or MRI, they have already a built-in AI. Now, these AI softwares together with the hardware are together seeking registration in the FDA. So when FDA approves them, it's already as a package. Now, there are also certain AI products that are sold as a software itself. It's like a plug and play thing. So it's a software. So I think Dr. Erwin is asking if these kinds of AI can be evaluated as independent of the hardware.
Yes po, Doc. Because those kinds of softwares that Dr. Erwin is mentioning is called a standalone software. So FDA is, I mean, the ruling per se here in the Philippines, no. So if you intend your product to be sold separately, whether it's a software or an accessory, you have to register it separately. So the answer is yes. You can actually apply for a separate registration or notification for that AI software.
Dr. Erwin has a follow-up statement. I'm referring to the packaged software, not the separate or standalone software.
Package software would mean po, it's, what do you mean po by package software?
Dr. Erwin, could you clarify what do you mean by packaged software?
Hello.
Yes, Erwin, we can hear
Hello
you.
po.
Yes po.
Hello. Yes. My question regarding po is, for example, usually when, let's say, for example, I saw in your presentation earlier that if a product is to get a certification and it's part of a system, you are to define the purpose of that product within the system and not simply as the system itself. So, for example, in AI, because sometimes I'm talking about AI that's packaged with hardware. So, for example, you have a CT scanner, an MRI scanner, or an X-ray or a mammography machine. And then the intended purpose of that, obviously, for the MRI or the CT to diagnose. So when you give the certification for that, the question is, does the system diagnose? Of course, obviously, the machine will diagnose and it will get its certification. However, the product, the AI product itself, its involvement or its purpose in the system is to aid in the diagnosis or to help the radiologist in diagnosing using the hardware. So it tends to piggyback right on the certification of the hardware. So can a radiology department instead not really demand, but at least ask or ask that the certification for the AI use as part of the system and not just in unison with the system, can we ask that it be evaluated separately from the hardware itself? Can we do that?
Yes po. Pwede naman po yun, Doc, depending on the applicant itself, depending on the importer or the company. If they can actually have it registered, the hardware itself and the software in one registration, but they can also have it, the software or the AI software itself in another application. Depende po yan sa ano ng importer, sa applications ng importer, but this can be done separately po.
So actually my question is, as the end user, for example, you have a CT scanner MRI, it has AI baked in. The CT and MRI is approved and it's certified by the FDA. But does that mean that we should also assume that the AI that's baked into the hardware is also FDA approved, or we should not assume that? When we get approval, the CT and the MRI and the X-ray machine is FDA approved, that it only means that the hardware is approved. That doesn't necessarily translate that we should assume that the AI baked into the software is also FDA approved.
Actually, Doc, because when we are submitting application, specifically with softwares, we provide the documents itself, the technical documents of the software. So technically, the FDA is evaluating the software also. Apart from the hardware, they are also evaluating the softwares because we needed to submit software validation protocol, the process, the reports. So technically, yes, it's being evaluated by FDA.
No, yes, kasi Erwin,
So
when
my
they
next question
submit
is,
a hardware, when the hardware contains also the softwares, the programs, the AI, it's enumerated. So each software is also detailed. The purpose, how it came about, the data sets that were collected, the previous research. So it's treated as an independent product within a bigger product. So that's what the companies are telling me, the CT scan and MRI companies are telling me. That's why there are also certain, if for example, they want to add a new AI in that hardware, they need another FDA approval for that.
Romel, Romel has an input po. Romel, go ahead.
Yes, Romel, yes. Romel?
Sir
Yes.
Erwin, based on experience, I already applied some of those, which are a machine and then the software. For this case, for as reference, if you're asking if the AI can be yung makikipigibak siya dun sa certificate ng machine, you can check on the product code if the version of that AI is written on the product code part. For example, product code ABC version AI 001. If that version match your AI version, then it's included on the certificate. If not, it's only the machine's product code, then it's not included on the certificate. That's how you can.
Romel, is there a list in the internet to look at it? For example, CT scan brand X, and then it has an AI X1. Can I Google search in the Philippine FDA, or does the Philippine FDA have a list of approved CT scan brand X with AI X1?
Currently, sir, we have a general verification portal wherein you can search the actual product you are if you have not yet used this website, this is being maintained by FDA. This is called a verification portal. You can Google it and it will bring you to the link. You will go now to the center. As per our explanation, the FDA is divided into 4 centers. You go to the CDRR-HR. There, if your product is usually under CMDN or application, there is a medical device notification category. Then you can click that, and then once again you can search for this certain name, specific name, specific country, country of origin or manufacturer. It will give you the results, and then you can check on that doc if the one you're looking for is already there. If not, then it's not yet registered in FDA.
Doc, one additional, so one thing that you you can verify the list of product codes when you actually request for the CPR. So the CPR with or the CMDR or CMDN. So it will list already all the product codes of the devices, including the software. So if the company or the company itself included the software in its version, then you are sure that the product has been applied together with that software. So it was evaluated by FDA with the software.
Okay, thank you for that, Melody and Romel. So how about medical devices that are not yet FDA approved, but however are, for example, being used in a hospital or hospitals for research or are donated? Before utilizing these devices, should these manufacturers acquire a CMDL from the FDA before it becomes operational? Or can the CMDL be processed while it is being operational?
Just to clarify, Doc, no, the CMDL certificate, that certificate shall be procured or secured by a local company also. So if the local company would want to import a product that is for donation, for personal use, or for testing or for research, then that local company should apply for CMDL, because during importation, it will be asked by the customs, what certificate will you provide me to release this product? So if it's for donation, for research, so the appropriate certificate is CMDL.
So how long can a product become CMDL? Kasi there are some products that are used for research, and then after having good results, they are now to be sold commercially. So how many months or years does a CMDL become is valid and thus requires notification or registration after it lapses?
Actually, the CMDL certificate po kasi, because it has list of requirements, no? So some of the requirements for CMDL, in order for you to support that this product is for research or for clinical trial, you have to provide also supporting documents like clinical trial protocol. So there is a period already indicated there. But as per FDA, no, when we made an inquiry about the CMDL is for one-time use only. You cannot apply for another CMDL for the same product. So if you already have a CMDL for one device, then the next certificate that you need to secure already, if you are importing again that same medical device, it could be the CMDN or CMDR.
So for donated products also, not just for studies. So if, for example, a product that came from another country is to be donated to a hospital, they need to secure the CMDL. Is there also a lapse for that? So when they donate that material or that device, as long as it is used as a donation, it is to have a CMDL, but is there an expiry date for that?
That one, Doc, we need to check with with FDA, because we do not have experience yet for securing CMDL via donation. So we'll check on that with FDA and we'll get back to you na lang po on the CMDL for donations.
Actually, marami, kaya lang siguro kasi hindi namin alam na kailangan pala. Akala kasi namin kapag libre, syempre pag libre, bigay sa iyo, magreklamo ka pa ba? So kapag donation, akala namin, okay lang, sige, gamit dito. Pero we need pala to secure a CMDL, yes, via the local distributor under the FDA. So I think that's a very valuable information for all of us, including the doctors. So if there's a donation and it's not yet FDA approved, we need to secure a CMDL. Okay, actually, these policies are changing. As Romel has pointed out, there are a lot of drafts, and incidentally, these drafts are also made for public evaluation and opinion. So take time to read these drafts. Sometimes they're posted in our website and in our social media. So for those who are here, just look at them and then see if they're satisfactory to you, so that we can have an active participation. Because in radiology, we are very much in contact with the various medical devices. So of course, it's our name that is indicated in the report. And of course, in these reports, the machines are also indicated. So whatever happens and it's not yet FDA approved, our names will be included in these controversial issues as well. Okay, so are there any other questions? Melody, Laurie, and Rommel, do you still have some important things to say to us? Or
Actually,
special
Doc, siguro,
messages or requests from us as doctors or even end users?
siguro po, Doc, no, as healthcare provider, no. So as what you've mentioned, it's very important for you na before using any medical devices, that medical devices shall be registered or notified to FDA. This is for you to have a peace of mind that the product has been evaluated for its safety and effectiveness. So you can, I mean, it's normal po for healthcare providers or even the hospitals or clinics to ask for the copy of the product approval certificates. If the company cannot provide you CMDN or CMDR, so medyo magdalawang isip na kayo. Pero at this point po kasi, Doc, because we have transition period and it doesn't end pa eh. So as what Romel have mentioned, Class B, C, and D medical devices that are not included yet, no, in the registrable list of medical devices, they can actually be freely imported and distributed in Philippines using a valid LTO. But after March 31, no, starting April 1, 2023, all of these medical devices, Class B, C, and D, whether or not included in in Annex A, they should secure already a product authorizations from FDA. So I think yun yung major takeaway dun sa discussion, that they have to take note of the end of the transition period, because the director of FDA actually, she didn't provide another extension because previously the transition period supposedly shall end this March 31, 2022. But because many of the companies have not yet secured their CMDNs or CMDRs, they asked for an extension. So we were provided a 1-year extension already. So we have to, I mean, as early as, it's actually December na po eh. So 3 months na lang mag-e-end na yung transition period. So make use of this time already to apply all your medical devices via CMDN or via CMDR. So in order for you to continue distributing your medical devices in the Philippines. Yun lang po, Doc.
Yes, that's true. Kasi ano na lang, ilang buwan na lang, March na eh. And itong mga process na to are not very simple. They're very complicated, and then pabalik-balik ka niyan, may kulang ng ganito, may maling arrangement ng ganito. And because of the complicated process of registering, it's sometimes confusing to determine which requirements are which, how to arrange which requirements. It's really advisable to seek the help of professionals and experts like Andaman Medical. Sila yung nakakaalam talaga to save on time and money and effort. It's really advisable to seek expert advices and professional work instead of doing it on your own blindly. And then especially for those first timers, hindi mo siya mag-google sa internet ng ganun-ganun lang eh. I've personally looked at the process and it's really confusing. I've been looking at them for months already, and it's not very easy to do it on your own. You really need help from the experts. There's another question like regarding the codes or sizes with approved CMDR. We haven't included other codes. The question is, how can we process amendments, adding sizes or codes? Can this affect the importation? This came from Julian Baldemore.
Pwede po mag-amend ng CMDR or CMDN certificates by filing CPR or CMDN amendment. So when filing this certificates, it actually affects during the importation, because if, for example, your commercial invoice contains as well the list of product codes, customs will also refer on the product name as well as on the code, the product codes itself. If your product code is not listed on your CPR or CMDN, that will be a big question from customs. So this will resulted into the delays of shipment because you haven't had the code on your CPR. So in order for you to amend your CPR, you need to file, as what I've mentioned, a CPR amendment, and you needed to provide copy of your labels, the labels of the additional codes that you needed to add, and also the other technical documents that is required for the additional code. Maybe I could check with Lori, because Lori has an experience on filing an application for CPR amendment for additional codes. So Lori, can you share your experience to the group?
Hello. Actually, if yun nga po, yung sabi po ni Miss Melody, kung yung codes wala siya dun sa mismong certificate, nahihirapan po talaga siya sa sa customs. So kung ganun po yung scenario, mag-file lang po kayo ng variation sa FDA, then magsasubmit lang po kayo ng mga requirements like labels and declaration letter, ganun po, para ma-add po yung mga codes. Then yung variation po, abutin po siya ng 1 to 3 months, pero depende pa rin po siya sa FDA. Or for example, yung mga nasubmit ko pong documents, hindi pa rin po siya kumbaga hindi pa rin po siya sapat kay FDA, then magkakaroon po din siya ng mga deficiencies na kailangan niyo pong i-comply. Ayun po.
Okay, thank you, Lori, for that information. Okay, are there other questions for our speakers? Okay, mukhang either na-satisfy sila sa mga questions or hanggang ngayon, dinadigest pa nila yung ating lectures. So it's really very complicated. The registration of medical devices is really a very complicated process. Actually, sa Asia, I think ang Philippines is one of the last countries to really finalize the policies in its medical device registration. Naunahan tayo ng ibang Asian countries. Okay, so if there are no other questions, I would like to request Miss Melody for some closing remarks regarding this webinar. Miss Melody, a few words for our viewers, please.
Okay, so once again, thank you po for attending this webinar. Short notice talaga siya kasi naurong siya ng naurong doon sa schedule. So, pero thank you po na nag-attend kayo sa webinar namin. Siguro, takeaways lang, as what I have mentioned a while ago, so by heart siguro, the companies itself, you have to know your medical devices. Para ma-register nyo rin siya properly kay FDA, you have to know by heart your medical devices. And second, you have to be aware of what is the new regulations and upcoming regulations with FDA kasi it will change some of the processes that we are doing right now. So lastly, siguro we have to build also rapport sa FDA because sometimes if pag kay FDA, medyo okay naman pag may deficiencies, syempre i-justify mo siya, no? Pero not to the point na parang ina-antagonize mo siya. Kasi pag ginawa natin yun kay FDA, minsan na-affect din yung processing ng evaluation nila. So parang imbis na bibilis, tatagal lalo. So we have to be friendly din kay FDA. So siguro yun lang yung mga tips kasi yun yung mga pinapractice namin sa ngayon. Being a regulatory consultants, no, in the industry. So yun yung mga tips na pwede kong ma-share sa inyo. So other than that, again, yung transition period, remember po, mag-end na po siya by March 31. So make use of this time po to submit all your medical device applications para po ma-continue natin yung supply ng medical devices dito sa Philippines. Yan lang po.
Okay, thank you, Melody. Ako naman siguro for the doctors, as end users and as the doctors who will have their names on the reports, we should know also our medical devices. We should know them and then specifically determine if these are all FDA approved. Kasi hindi lang yung hospitals or doctors are gonna be affected. It's also the company itself. Kasi once na-discover siya ng FDA na ginagamit na natin siya pero hindi pa siya FDA approved, mahirapan siya mag-seek ng registration kasi parang naka-blacklist na siya. Parang mababad trip si FDA na ganun yung company. So, magsasuffer din yung company. So, let's also help these companies para baka kasi hindi sila aware, okay, of our regulations and policies here in the Philippines. Now, knowing these basics, we have to tell them na, oh, ganito, you need Philippine FDA approval kahit na US FDA approved pa siya or European FDA approved siya. Ang importante yung Philippine FDA approved. And then kailangan meron silang local distributor dito who will be the one in charge of registering that product here in our Philippine FDA. And if they have no or limited experience in that, seek the services and the help of experts and professionals like Andaman Medical. Okay, so with that note, I would like to thank, of course, the staff of Andaman Medical, Mr. Rommel, Ms. Lori, and of course, Ms. Melody for sharing their knowledge to all of us and enlightening us kahit papaano with this medical device registration. It's a very complicated topic. This 1 to 2 hour session is not sufficient. However, we hope that we have shared significant data to you for us to have a different point of view regarding medical device registration. And I hope now when we invite again Andaman, hindi kayo magsawa with our invitation. So I hope you guys enjoyed and learned a lot from this session. And to the staff of Andaman, maraming salamat for giving us this information about medical device registration in the Philippines.
Thank you
Thank
din
you very
po.
much. Maraming salamat, Melody, Lori, and Rommel. Maraming salamat. And thank you to our viewers who have stayed for this webinar kahit na medyo late na. And enjoy the rest of the weekend. Maraming salamat and always stay safe. COVID is still around. Thank you, PCR, for hosting this Zoom platform also. Maraming salamat, everybody. Ingat lagi.
Thank you.
Can we
Thank
have
you
a group
po.
picture pala? Can we have a group picture?
Ayo po.